Younger than 70 with no signs of prostate cancer may no longer be discouraged from checking their PSA levels. There's some new guidelines that are being proposed by the U.S. Preventative Services Task Force, but experts say that a positive test may have left some confused about what do you do next. So let's break it down with Dr. Ali Kazrayan back here on the morning show. So do you agree with these proposed changes?
Some of it. I think it's a great step in the right direction. So one way to kind of think about it, before the U.S. Preventative Services Task Force gave us a grade D recommendation for PSA screening, so don't test. Now the new recommendation, or a grade C recommendation, say see your doctor. Basically, they emphasize shared decision making. So for men between 55 and 69, they thought that men should individually make a decision based on their discussion with their physician regarding the risks and benefits of prostate cancer screening with a PSA test. And we, as urologists, recommend a digital rectal exam and make a decision for themselves whether the risks and benefits of doing so make sense for them. Obviously, as urologists, we're biased. We think PSA screening saves lives, and the data actually shows that. So the data that they looked at was actually, it's the same studies that they looked at from the previous recommendations in 2012. However, following those studies for 5 years longer, they found that, especially the European study, found that screening, the men in the screening arm, had less prostate cancer specific mortality, meaning that the men who were screened did not die of prostate cancer at a lower rate, and they didn't have as much metastatic disease.
Okay, but this goes beyond just the PSA level, because when your PSA reaches a certain level, it also prompts additional testing, maybe biopsies. And the worry was that these additional tests may have been more harmful than doing good.
So the question of overdiagnosis versus overtreatment. So one other factor that they took into account, the world of urology in the past looked at prostate cancer screening as a marriage of diagnosis and treatment. So most people who are diagnosed with prostate cancer, regardless of stage and grade, would get treatment. We've split that paradigm by bringing into treatment and management of prostate cancer the idea of active surveillance. So right now, between 45 to 50% of prostate cancers that are low risk and low volume can be monitored with active surveillance. So not all prostate cancer that's diagnosed is treated. So you shift that mindset a little bit so that not all diagnosed prostate cancer is treated with the harms that they talk about, so that you're changing the way that we discuss prostate cancer. So this personalized, individualized prostate cancer care begins with screening. And the concern here is that prostate cancer screening with the PSA test and the rectal exam does save lives. So where does that discussion begin? And so if you individualize it, that can make this a more personalized discussion for the patient. The challenge with this as urologists is that primary care physicians are overworked. Patients may not have the time or the wherewithal to have this discussion, where before you go to your doctor, you get a bunch of labs, the PSA is included, you have no idea until you get a call that your PSA is up, go talk to a urologist. If that same gentleman doesn't know to initiate that conversation, the primary care physician either doesn't have the time or it does not necessarily believe that PSA screening makes sense, because again, this just came out. There's a generation of primary care physicians who may not believe in PSA screening because that's the guidelines still don't recommend it based on the previous U.S. Preventative Services Task Force recommendations. That may be challenging. And we're seeing in the world of urology, based on the 2012 recommendations, we have less screening, we have less diagnosis of prostate cancer, less biopsies and less treatment, and that has shown a shift in more metastatic disease and more people with advanced prostate cancer that are getting diagnosed later. And that's dangerous in certain populations, family history, African-American populations. So what I would take away from this, talk to your doctor about PSA screening. It may save your life, but start talking to them about getting that first PSA in your 40s. There's study after study that shows that that's the most predictive and most telling.
Early prevention.
But the most telling of your future prostate cancer.
And the moral of this story is go ahead and monitor the screen levels, but don't rush to treatment. So a lot of good information there that could help save your life or that of a man in your family. Share this interview with them later this morning. It'll be on newsforjax.com on the morning show page, along about 10:30, 11 o'clock. Doc, thanks for being here. Appreciate it.